Article 210.6a of the National Electrical Code, NEC, addresses voltage limitations for branch circuits supplying lighting units mounted in or on ceilings or walls. The article states that branch circuits supplying lighting units mounted in or on ceilings or walls shall not exceed 150 volts to ground. However, Article 210.6a is not directly applicable to patient rooms in hospitals. Patient rooms are specifically covered by Article 517 of the NEC, which addresses the electrical requirements for healthcare facilities. Article 517.18c of the NEC states that for patient care areas, lighting fixtures and other equipment shall be listed and marked for use in patient care areas. The fixture or equipment shall be installed to minimize the accumulation of dust on surfaces and to facilitate cleaning. While Article 210.6a does not directly apply to patient rooms, Article 517.18c requires that lighting fixtures in patient care areas be listed and marked for such use. This includes lights over patient beds. Standard lighting fixtures used in patient rooms are typically rated for 120 volts, which is below the 150 volt limit specified in Article 210.6a. Therefore, the light over a patient bed should be supplied with 120 volts, not 277 volts. In summary, based on the NEC requirements for healthcare facilities, the light over a patient bed should not be supplied with 277 volts. It should be supplied with 120 volts to ensure that the fixture is properly listed and marked for use in patient care areas. To elaborate further, understanding the specific requirements outlined in Article 517 is crucial when dealing with electrical installations in healthcare facilities. This article supersedes the general requirements in other parts of the NEC when there is a conflict. This means that even if Article 210.6a might seem relevant at first glance, the stipulations in Article 517 take precedence in patient care areas. The requirement for listing and marking of lighting fixtures, as detailed in Article 517.18c, is designed to ensure that the equipment is suitable for the unique environment of a patient care area. This environment often involves stringent cleaning protocols and the need to minimize dust accumulation, both of which can affect the performance and safety of electrical equipment. The listing and marking indicate that the fixture has been tested and certified to meet these specific requirements. The voltage limitation is also a critical safety consideration. While 277 volts lighting systems are common in commercial and industrial settings, they are generally not used in patient care areas due to the increased risk of electrical shock. The lower voltage of 120 volts provides a greater margin of safety, particularly in an environment where patients may be more vulnerable. It is also important to consider the grounding and bonding requirements in patient care areas as outlined in Article 517. These requirements are designed to minimize the risk of electrical shock by creating a low impedance path for fault currents. The grounding system must be carefully designed and installed to ensure that it is effective in protecting patients and staff. Furthermore, the NEC requires that all electrical equipment in patient care areas be regularly inspected and maintained to ensure that it is in safe working condition. This includes lighting fixtures, receptacles, and other electrical devices. Any equipment that is found to be damaged or defective must be repaired or replaced immediately. In addition to the NEC requirements, healthcare facilities may also have their own internal policies and procedures for electrical safety. These policies may be more stringent than the NEC requirements, and they must be followed by all personnel who work on electrical equipment in the facility. When selecting lighting fixtures for patient care areas, it is important to choose fixtures that are specifically designed for this type of environment. These fixtures should be listed and marked for use in patient care areas, and they should be easy to clean and maintain. They should also provide adequate illumination for the tasks that will be performed in the area. The design of the lighting system should also take into account the needs of the patients. The lighting should be comfortable and non-glare, and it should be adjustable to allow patients to control the level of illumination. In conclusion, while Article 210.6a sets a general voltage limit for lighting circuits, it is not the governing rule for patient rooms in healthcare facilities. Article 517 provides the specific requirements for electrical installations in these areas, including the type of equipment that can be used and the voltage limitations that apply. The selection and installation of lighting fixtures in patient care areas must comply with these requirements to ensure the safety of patients and staff. First, consider the overall safety implications of using higher voltage systems in patient care areas. Secondly, ensure compliance with the specific requirements of Article 517 of the NEC. Thirdly, always prioritize patient safety when designing and installing electrical systems in healthcare facilities. Fourthly, consult with qualified electrical engineers and contractors who have experience working in healthcare facilities to ensure that the installation meets all applicable codes and standards. Finally, remember that the NEC is a minimum standard, and healthcare facilities may have additional requirements that must be followed. The NEC provides specific definitions for terms used throughout the code, including those related to healthcare facilities. Understanding these definitions is essential for correctly interpreting and applying the code requirements. For example, the NEC defines a patient care area as any portion of a healthcare facility wherein patients are intended to be examined or treated. This definition is important because it determines which areas of the facility are subject to the requirements of Article 517. The NEC also defines different types of patient care areas, such as general care areas and critical care areas. Each type of area has its own specific requirements for electrical safety. For example, critical care areas, such as intensive care units, have more stringent requirements than general care areas, such as patient rooms. These more stringent requirements are implemented because of the increased risk to patients in critical care environments. When designing electrical systems for healthcare facilities, it is important to consider the potential for electromagnetic interference, EMI. EMI can disrupt the operation of sensitive medical equipment and can even pose a safety hazard to patients. To minimize the risk of EMI, the NEC requires that electrical systems in healthcare facilities be designed and installed to minimize the generation and propagation of EMI. This can be achieved by using shielded cables, grounding and bonding equipment properly, and separating electrical circuits from sensitive medical equipment. The NEC also requires that healthcare facilities have a written electrical safety plan that addresses the potential hazards associated with electrical equipment. This plan should be reviewed and updated regularly, and all personnel who work on electrical equipment in the facility should be trained on the plan. In addition to the NEC requirements, healthcare facilities may also be subject to state and local regulations regarding electrical safety. These regulations may be more stringent than the NEC requirements, and they must be followed by all personnel who work on electrical equipment in the facility. It is important to stay up to date on the latest changes to the NEC and other applicable regulations. The NEC is revised every 3 years, and it is important to be aware of any changes that may affect the design and installation of electrical systems in healthcare facilities. Attending continuing education courses and participating in industry organizations can help you stay informed about the latest developments in electrical safety. When working on electrical equipment in healthcare facilities, it is important to use appropriate personal protective equipment, PPE. PPE can protect you from electrical shock, burns, and other hazards. Common types of PPE include rubber gloves, safety glasses, and insulated tools. It is important to inspect your PPE before each use to ensure that it is in good condition. If you find any damage or defects, do not use the PPE. Replace it with new PPE. When performing electrical work in healthcare facilities, it is important to follow lockout/tagout procedures to prevent accidental energization of equipment. Lockout/tagout procedures involve disconnecting the power supply to the equipment and placing a lock and tag on the disconnect switch to prevent someone from accidentally turning the power back on. It is important to follow these procedures carefully to prevent serious injury or death. The NEC requires that healthcare facilities have an emergency power system that can provide power to essential equipment in the event of a power outage. The emergency power system must be designed to automatically switch on within 10 seconds of a power outage. The emergency power system must be regularly tested and maintained to ensure that it is in good working condition. In addition to the emergency power system, healthcare facilities may also have an uninterruptible power supply (UPS) system that can provide power to critical equipment for a short period of time in the event of a power outage. The UPS system is typically used to power equipment that cannot tolerate any interruption in power, such as life support equipment and computer systems. The UPS system must be regularly tested and maintained to ensure that it is in good working condition. When designing electrical systems for healthcare facilities, it is important to consider the needs of patients with disabilities. The Americans with Disabilities Act, ADA, requires that healthcare facilities be accessible to people with disabilities. This includes providing accessible electrical outlets, switches, and other electrical equipment. It is also important to provide adequate lighting in accessible areas to ensure that people with disabilities can safely navigate the facility. The NEC contains specific requirements for the installation of electrical equipment in hazardous locations, such as areas where flammable gases or vapors may be present. Healthcare facilities may have hazardous locations, such as operating rooms and laboratories. It is important to identify any hazardous locations in the facility and to install electrical equipment that is specifically designed for use in these locations. The NEC requires that electrical equipment in healthcare facilities be inspected and tested regularly to ensure that it is in safe working condition. Frequency of inspections and testing depends on the type of equipment and the environment in which it is used. It is important to keep records of all inspections and testing to demonstrate compliance with the NEC requirements. When performing electrical work in healthcare facilities, it is important to be aware of the potential for exposure to infectious diseases. Healthcare facilities may contain patients who are infected with a variety of diseases, and it is important to take precautions to protect yourself from infection. This includes wearing appropriate PPE, such as gloves and masks, and following proper hygiene procedures. Healthcare facilities are complex environments with unique electrical safety challenges. By understanding the NEC requirements and following safe work practices, you can help to ensure the safety of patients, staff, and visitors. The NEC provides specific requirements for the wiring of patient care areas in healthcare facilities. These requirements are designed to minimize the risk of electrical shock to patients and staff. The NEC requires that all electrical wiring in patient care areas be installed in accordance with the requirements for isolated power systems. An isolated power system is a system that is designed to prevent ground faults from causing electrical shock. The NEC also requires that all electrical equipment in patient care areas be grounded properly. Grounding helps to prevent electrical shock by providing a path for fault currents to flow back to the source. The NEC provides specific requirements for the location of electrical outlets and switches in patient care areas. These requirements are designed to make it easy for patients and staff to access electrical equipment without having to reach or strain. The NEC requires that all electrical outlets and switches in patient care areas be tamper-resistant. Tamper-resistant outlets and switches are designed to prevent children from inserting objects into the outlets. The NEC provides specific requirements for the lighting in patient care areas. These requirements are designed to provide adequate illumination for patients and staff while minimizing glare and shadows. The NEC requires that all lighting fixtures in patient care areas be listed and labeled for use in healthcare facilities. Listed and labeled lighting fixtures have been tested and certified to meet the safety requirements for healthcare facilities. The NEC provides specific requirements for the installation of electrical equipment in operating rooms. These requirements are designed to minimize the risk of electrical shock and explosion in operating rooms. The NEC requires that all electrical equipment in operating rooms be explosion-proof. Explosion-proof equipment is designed to prevent explosions from occurring in the presence of flammable gases or vapors. The NEC requires that all electrical equipment in operating rooms be grounded properly. Grounding helps to prevent electrical shock by providing a path for fault currents to flow back to the source. The NEC provides specific requirements for the location of electrical outlets and switches in operating rooms. These requirements are designed to make it easy for surgeons and other medical personnel to access electrical equipment without having to reach or strain. The NEC requires that all electrical outlets and switches in operating rooms be tamper-resistant. Tamper-resistant outlets and switches are designed to prevent children from inserting objects into the outlets. The NEC provides specific requirements for the lighting in operating rooms. These requirements are designed to provide adequate illumination for surgeons and other medical personnel while minimizing glare and shadows. The NEC requires that all lighting fixtures in operating rooms be listed and labeled for use in healthcare facilities. Listed and labeled lighting fixtures have been tested and certified to meet the safety requirements for healthcare facilities. The NEC provides specific requirements for the installation of electrical equipment in X-ray rooms. These requirements are designed to minimize the risk of electrical shock and radiation exposure in X-ray rooms. The NEC requires that all electrical equipment in X-ray rooms be shielded to prevent radiation from escaping the room. Shielding is typically made of lead or other dense materials. The NEC requires that all electrical equipment in X-ray rooms be grounded properly. Grounding helps to prevent electrical shock by providing a path for fault currents to flow back to the source. The NEC provides specific requirements for the location of electrical outlets and switches in X-ray rooms. These requirements are designed to make it easy for medical personnel to access electrical equipment without having to reach or strain. The NEC requires that all electrical outlets and switches in X-ray rooms be tamper-resistant. Tamper-resistant outlets and switches are designed to prevent children from inserting objects into the outlets. The NEC provides specific requirements for the lighting in X-ray rooms. These requirements are designed to provide adequate illumination for medical personnel while minimizing glare and shadows. The NEC requires that all lighting fixtures in X-ray rooms be listed and labeled for use in healthcare facilities. Listed and labeled lighting fixtures have been tested and certified to meet the safety requirements for healthcare facilities.